Good morning,
Good morning.
everybody, and welcome to Beyond Telehealth. I'm Dr. Lisa Finkelstein, and this morning we're going to do something a little different than what I've done in the past couple of months. Instead of interviewing physicians, we're going to interview two of my favorite people in the world who are also patients, Dick and Val Beck. And first, we're going to start with Dick. We're going to try to keep this 5 minutes with the Fink for each one of you guys. So, Dick, we'll start with you first. And if you can introduce yourself, tell us where you live and how young you are.
Okay, we live in Jackson, north of town, out toward the airport. Just a few minutes out from town toward the airport.
Jackson where? There's lots of Jacksons in the United
States. Oh, I'm sorry. Jackson, Wyoming.
There we go. Okay.
And I'm 87. And
years young. Okay. And the next question is, so were you using any form of telemedicine prior to the pandemic, prior to March?
No telemedicine, no.
Okay, so this is starting in March, you had to go on video visits. And who have you used telemedicine with? What physicians and how many telemedicine visits have you done?
I've done probably a half a dozen, 5 or 6, and I've done one with my urologist. Not you as my urologist, because you know doing all this stuff now, and then 4 or 5 times with my internal medicine doctor.
Perfect. All right. When you first started doing this, did you find it intimidating or any way? Did you have trouble downloading? We use HIPAA compliant Zoom. Did anybody help you with that?
No, not with this. It was very simple, very easy to use.
And why is that? Why are you, you're 87 years young, and the myth, this is a myth busting opportunity right now, Dick, because when we started talking about telemedicine way back when, the myth was that older people would not be able to engage with the technology, that they would find it too difficult. How come that wasn't the case with you?
Well, I'm not a computer genius, as Val will tell you, but I do use it for a number of things. I use Zoom for a lot of meetings on organizations I'm involved with. And so it's just, I sometimes struggle getting on, but once I'm on, no problem. And
right.
This one has been the easiest one, frankly. It's a lot easier than Zoom.
Okay. And generally, what's your opinion about the quality of the visits for what you're doing with your internal medicine physician? How's that been going for you?
It's been going very well. It saves a trip. You know, my urologist is 15 miles from here. My internal medicine doc is closer to 18 or 19 miles from here. So we're in a bit of not quite rural, but almost rural Wyoming. And it's a real easy way to meet with my docs.
Okay. And one of the aspects of doing a traditional visit was to have the patients coming into the office so that you could get your blood pressure, you could get your heart rate, you could get your weight. Are you doing any of this at home before your visit? Do you have that at home? Yes?
Yeah. We have a blood pressure monitor, and I weigh myself every morning as a routine. And heart rate is very simple. That's part of the BP. So
Okay. Do you have a pulse ox, either one of you guys? And you have a pulse ox too. Okay.
Yeah, that's a recent addition.
You guys are like the perfect patients I picked. No coincidence. And when you meet with your internist, looking or utilizing those vital signs, are they able to, or do they ever adjust your medicines on a video visit?
There hasn't been a need to, no.
Okay.
No.
All right. You know, one of the terms that we like to use, or I like to use with these types of visits, it's like a virtual house call. So remember back in the day, maybe when you were younger, that physicians would come to the house and see you in your house. This is kind of like that. Do you think or not?
Yes, there's one difference. When I was 6 years old, the doctor was in a hurricane in the Massachusetts area, and the doctor came to my house to take out my tonsils on the dining room table. So,
I forgot about that. That's right. That really happened.
yes.
Wow. Okay. Well, we are not able to do that yet. But with, robotics and virtual and AI and all of this stuff, you never know.
That's right. I agree.
Send a robot to the house.
Yeah.
It's amazing. All right, Dick, let's move to your better half, Val. And let's start with Val. So, Val, thanks for joining, you guys. And if you can introduce yourself, we know where you are, and tell us how young you are.
Okay, so I live with Dick in Jackson Hole, and I'm 70 years old. My name is Val.
Okay, and tell us your experience and what physicians have you utilized telemedicine with?
So my experience also started in March. I was sort of freaking out over the potential problems with the pandemic, and I was having some anxiety problems. So that's what started my conversation with my doctor. I think I saw her once before that, and then thereafter I had televisits with her, and I think I had 4.
And do you feel that they were just as good, not as good as being there in person?
They were just as good, if not better in a way, because you have a completely unfiltered conversation. There's no extraneous noise outside or people knocking on the door, if they had to have something signed or something. And I don't know, it just seemed like it was more focused, and that we had a really comprehensive conversation.
Do you think that that there's a difference between doing a telemedicine visit on the telephone versus doing, where she can actually look at you?
Oh, I think it was really important that she saw me, because I think I'd lost 13 pounds in a week or something like that, because I was really freaked out. And she could tell.
Right.
And so she had some real concern about that. And so anyway, I thought it was really helpful. And she, had thoughts about what to do and what was going to come next. And I had a couple maladies this year. That was one, and another was a really bad bladder type infection that we cleared up mostly by relieving my stress. And then,
right.
and then I had an accident with one of my dogs where I got scraped by teeth. And so that was a follow-up. I went to emergency room, and then we had follow-ups with her.
Is that something that you had to actually show a wound? Did you have a wound that she could look at?
Yeah, and she had a report from the emergency room. So she called me, because they told me at emergency to only come back if I was having a problem. And 2 days later, she had gotten the report, and she called me and said, I want to see you right now. And I said, see me how? And she said, we can do this over the phone as long as there's no problem.
Over the phone or
I mean,
video?
I'm sorry, over telemedicine.
Over Zoom. Okay. And one of the nice things for you who has anxiety is part of your anxiety, I think, is because Dick is 87 years young and at high risk. Not you are too, but you're afraid of potentially bringing something home to Dick. So it's kind of like a win-win, right?
Right.
So you don't have to sit in a waiting room full of contagious people.
Absolutely. I mean, we are isolating pretty heavily here. I go to a very, very, very early shopping area once every week or 10 days, and that's it. We have not been out doing anything.
Wow. Yeah, it's been pretty extraordinary measures. And, the other fascinating thing is that both of your internal medicine doctors were not so gung-ho with telemedicine way back when we had talked about it before the virus. And now they have embraced it as well. So it's not just the patients, but also the physicians that are starting to come on board with telemedicine.
Yeah.
Nice.
Lisa, I'd like to make just one quick comment. I think one of the real advantages of telemedicine is for people who live in a rural area, and we aren't quite in what I would call rural, but certainly for those who aren't in truly rural areas, having telemedicine available is the only way to go. Not the only way, best way to go.
I know, and where you guys live, really where, Wyoming is, and especially Jackson Hole, we call it Snowmageddon, is just around the corner.
Yeah.
Where blizzards happen fairly frequently.
Yes.
And so, living in Pinedale or where you have to go, or over in Victor, Idaho, over the pass, or Du Bois, over Togety, the list goes on and on. But certainly telemedicine, the model started because of rurality and people living in very remote areas that can't get to their urologist who lives hours away.
Right.
Yes.
And many times, Dick, as you know, with a cancer diagnosis, you don't have to. Many times, it's just reviewing how you are and your medication, and it's not every time that somebody needs to actually examine you with, each visit.
Yep.
Yeah. So let's leave it with the last question for both of you guys is, do you think that telemedicine is here to stay?
Yes, I absolutely believe that. And I hope that there aren't any things that stop it from staying. I think that, as you mentioned, some of the physicians haven't taken it as easily as we might like them to, but I think that's changing.
I'm really happy about it. Any time I don't have to leave home for a day, I'm really happy. Even when there's no pandemic, just the time that it takes to do that, to sit in a waiting room when another patient might need more time, and you're delayed, is just, I just sort of don't want to spend that kind of time. And this is so direct. It's so well scheduled. And then if the doctor wants to see me, I'm happy to go in. But if it's just to talk something over, this is just so much more convenient. It makes so much more sense. It's good for the planet.
Right? Right. There's so many reasons. Well, we really count on patients like yourselves, to send that message to your legislators, to your insurance companies, the people that pay for these things. And that's where we're going to be once the pandemic is over, that's the question, because our physician's going to want to keep doing telemedicine visits if they're not going to get paid. We know the answer to that. And so it's coming from patients that say, this is a sustainable model for our healthcare system. It will reduce costs, all the reasons that you guys mentioned. Let them know that that you would love for this to stay, and you'll ask for this.
Well, the geriatric population that's doing it right now, it may be a little foreign to them. They may not have as much skill at using their computers and stuff. But if you start with people in their 50s right now who are already very computer literate, and they eventually go up to their 80s and 90s, it's going to be no problem to them.
I heard one story. We'll leave with this, where I think it was a physician that told me that they had a 90-some-year-old woman who, all her marbles, everything, but couldn't figure out, how to get on the computer, and went to the Verizon store and asked the Verizon guy to help her get on so that she could have a visit with her doctor. So she, was trying to figure it out.
Good for her.
Yeah.
Well, I have to figure out the sound on mine, so.
Yeah, I'm not sure. See, we did have a technological issue in the beginning. I don't know. Well, you guys, Dick and Val, thank you for coming on board and engaging with Beyond Telehealth. And we'll see you soon.
Okay. Thanks, Lisa.
Thanks.
All right.
Bye.